yeah, so basically during the pandemic, it was just some of the feedback from some of our carers about that interaction with professionals, the support they were getting, and how they can make that improvement with the rights of obviously the carer and confidentiality, and also obviously the rights as a carer of you supporting somebody with a mental health condition, and how we can keep that triangle of care in place to make sure that that information is being passed back to professionals. So again, we've got to respect the wishes of the person that's being cared for, so they might not want to share information with you. But on the other flip side of that, as a carer, you've got important information that can help that professional, and how you can interact, and also when you have that person home with you, how you then can communicate with professionals and share that information. So like I said, I'm going to be reading off the presentation because obviously you know, Sophie's not able to attend today, but again, that was part of what's been put in the mental health handbook. I think the majority of you have got that in a PDF. If you haven't, please just put a comment in the chat. I can make sure then we can get that PDF over to you. But also if you're coming to the carers event on Thursday, we will have those handbooks in paper form available to hand those out now as well. So again, Gloucestershire Health and Care, we worked with the Foundation Trust. So they provide obviously support for mental health, physical health, and learning disability services across the services of Gloucestershire. And they do this in the hospitals, in the community buildings, and primarily, start there, I would say predominantly, primarily in people's own homes. So they support people obviously out in the community as well. Joe, are you able to just roll that screen up a bit? That's brilliant. Okay. So based on some of the conversations with the groups that I ran, was that information about how we as carers can share information with professionals, and what professionals can share with carers, but also keeping the rights of somebody's rights to confidentiality and what can be shared. So it's about those common sense conversations that you can have with a professional. So a professional couldn't actually share information as in if somebody's decided they don't want to share information at that time, but you've got important information that you want to share to that professional of how best to support that individual. So it's about when you have that communication with somebody, that you're not asking for that private information. What you're just trying to say is that I know there's confidentiality in place, but what I just need to be able to share with you is, and then you can have that conversation with them, that professional. You're not asking for them to break confidentiality, but what you're trying to do is to share important information with that professional that could help that person that's being cared for. So again, if somebody is being cared for, it could be a friend, obviously family member, sharing information between staff and carers is vital to the care and treatment of that friend or relative. So providing information about care plans and medication and advice and managing a crisis may be able to help with someone's difficult situations that might be coming up. So again, you've got vital information that needs to be shared with a professional. Joe, if you want to just scroll up, that's brilliant, thank you. So again, there's something that I've already touched on. It's those issues around sharing information. So healthcare is professional between patients, families and professional care staff. Sometimes there can be a difficult relationship when sharing obviously confidential information. So again, it's about when a patient wishes to hold information from you, these wishes must be respected by the professional staff that are treating that person. But again, what needs to be shared with a carer is that important information needs to be shared with you at that time, that somebody at that time might not want to share information with you. But what they can share with you is to say, like, well, actually, this person is having a better day today, but we are obviously still continuing to support the person. It's about not saying that they cannot talk to you in shape or form, because obviously as a carer, it could be quite distressing. You provide all the support for people outside of the hospital setting they might be in, but you've got valuable information that you obviously need to be able to share with the professionals. And then the professionals need to respect obviously the rights of the person that's being cared for. So again, like I said, staff should ensure that carers receive as much information as possible to help them in their caring role. So this was another reasoning behind the handbook, because it's about what carers felt they needed, because again, they were coming up against the barrier of professionals just saying, well, there's no, there's no sharing agreement, we can't share any information, and then the conversation would be ended, which could be quite distressing for a carer to be able to share information. So it's about common sense information that you can and you can't share. So again, like I said, Joe, go back down again just a little bit. Issues, yeah, that's it. So again, issues with sharing with that information. So a good practice, staff will obviously cover the following areas. Discuss with that patient what particular information they wish to withhold. Discuss the importance of confidentiality with carers at an early stage, and their views of information sharing are recorded. Explain to carers what information can be shared and information cannot be shared, and the reasons behind the not able to sharing that information. And again, I think that's some of the feedback that I've received from carers, is that you don't always have that clear conversation of the reasons behind why that document or information about somebody cannot be shared with you. Again, professionals are obviously bound by law, and the professional codes of conduct, and have a duty of confidentiality to their patients that they're supporting at the time. And again, staff should explain to you that they have the same duty of confidentiality with carers in relation to any information they wish to discuss. Joe, if you can just scroll up again, that's great, thank you. So again, how can information be shared? So issues around confidentiality should not be used as a reason for not talking to carers. And again, I know that I've already highlighted this. This was something that was fed back within the groups, that some staff would say the bare minimal that we need to make sure that that information is shared and not shared. But again, it's about not having that conversation with a carer and just a carer coming up to a blank wall of like, well, you know, I can't speak to you about anything because that carer's the cared for's wishes. So it's about you know, that isn't a reason not to be able to have a conversation with a carer, and about their own needs as well. As a carer, are you able to provide that support for somebody if they then obviously are discharged from hospital? Are you going to be able to provide that care and support you need to be given that person, or you need to be offered support to be able to do that? Or there's a point within any caring journey that you're not able to offer that support anymore, and it's about you having that opportunity to have those clear conversations with that professional at that time, that you are not then put in a position that you feel that you're not able to provide that care for that person that you're caring for. And again, it's not about anybody being failing, or please don't have any guilt. We all have our limits as a human being, and also, you know, we all get older, we could all have our own health conditions as well. So if you're not able to provide that support, it's about having that two-way conversation at that point with those professionals. Joe, if you can scroll up, that would be, or down, I always say the wrong way, but that's great, thank you. Again, how can information be shared? So even when the patient continues to withhold consent, carers must be given enough knowledge to enable them to provide effective care. So again, like I said, this is some of the feedback that was put into that handbook, is that carers still needed information of how can they support that person when they are discharged or from whatever environment they are currently in. How can they give that person the right level of support if information is not shared with you about their condition or medication or anything? So it's about what information they can share with you that's going to enable you to support that person. And again, that's part of the courses that we have now got up and running about mental health crisis awareness training for carers. And again, within that handbook, it gives you all those steps of the things that you need to be able to do to look after yourself and your well-being. But again, it's about that opportunities you can discuss at that point with professionals about your caring role and any difficulties you may be having to obviously to provide that support. And again, the best time is the early communication with that team to put a plan in place to make sure the person you're caring for is looked after, and also you're looked after, and you're not doing things that are out of your remit or you're really struggling to be able to obviously cover. Joe, if you want to go out, that'd be great. So the provision of general information. So the provision of general information about an illness and emotional and practical support does not breach confidentiality. So this is where we've talked about that communication difficulty about what can be shared and what cannot be shared. So general information that can be shared, which includes the following. So information about the condition and the behaviour it may cause, advice on managing the behaviour, particularly in a crisis. So again, you might have the details of the care coordinator for that person. Again, you're entitled to know about the background information on a medication, and again, any side effects of those medication when you're caring for somebody. Again, information about the care programme approach and what is involved, so they can share that information with you. Again, they will share information about contact local organisation and support groups. Again, obviously contacting Gloucester Carers Service, and there'll be information within that carers handbook as well. Now there's a list of organisations to support carers. Joe, that'd be great if you can go up to the next. So the Carers Charter. So in line with Gloucester Health and Care, the values of the principles of the triangle of care. So that is ensuring there is a communication and support between the carer, the cared for, and professional. So based on that approach, it's about information on confidentiality, and information sharing will be given to service users and carers and discussed at the early stages, usually during assessment and then at reviews. Staff will help to patients to distinguish between sensitive and personal issues, which are to remain confidential, and more general information about the illness, which can be shared. Issues regarding confidentiality will be recorded within the patient's notes, so the staff are aware of any changes in that patient's attitude regarding confidentiality. So it's making sure they're updating, because if somebody starts to become better, their wishes of sharing information will change. So they need to make sure that they're constantly reviewing that sharing agreement, because as people become better and the treatment is starting to work, that person that's being cared for then might want to then start to share information that they didn't do at the beginning of their treatment. And also they might not have had the capacity at that time as well. Joe, if you want to go on to that, that's great. So again, the Carers Charter, the use of advanced statements, this will be developed and encouraged. This will allow patients to plan their care when they are well, and explaining what they would like if they became unwell. And again, that's about that interaction with carers as well, to make sure that you're aware of those persons' wishes. Staff will help patients to understand the benefits of sharing appropriate information with their carer. The care coordinator will also provide carers with the support and help needed on issues relating to information sharing and confidentiality. Again, carers should be made to feel welcome to ask questions, and time should be made available for you to be able to ask questions. Again, professionals will be involved with carers in treatment plans and in major decisions about that patient. Joe, if you want to go up to the next, that's great, thank you. Good practice checklist within obviously the carers' confidentiality within mental health. So the following checklist has been made. So this is a carers and confidentiality in mental health. The leaflet produced by Partners in Care campaign and published by the Royal College of Psychiatrists is designed to assist staff to work closely with their carers within the professional, within the boundaries of current legislation. I can't say that word, legislation, get the teeth in, and to help carers understand their rights. Joe, if you can go up to next, that'd be great. So what does a good checklist look like? So carers are given general information, both verbally and written. So this is something that we talked about within our groups, is that people needed information about the diagnosis of the person that they're caring for, especially if they're looking at somebody that has just had a recently diagnosed mental health condition, that they are not aware or how to support that person, or have limited information about that condition. And obviously information is key to be able to give that information to carers so they can support somebody in the right way. Again, we talked about what behaviour is likely to occur and how to manage that condition. Again, talks about the medication, the benefits of that medication, and also the side effects possibly that could happen while somebody's on that medication. There's local inpatient and community services. Again, we talked about the care programme approach, and again that you have access to local and national support groups, especially in relation to a specific condition. As you're aware, we also run event sessions for carers around specific topics in relation to mental health as well. So again, another things that you need to be aware as a carer. Carers are helped to understand the following. So the present situation of that person's condition, any confidentiality restrictions requested by the patient. So like I said at the beginning of somebody's treatment, they might not be in the situation where they're able to give consent, or because of their condition, they've decided they don't want to share any information. But again, that needs to be reviewed regularly when somebody's being treated. So that request will change around confidentiality. So again, it's making sure that there is that clear conversation with a carer, that it's not that they're holding information from you, it's just at that time that person has decided not to share information. So again, the patient's treatment plan and its aims, written care plans, crisis plans, or recovery programme, the role of each professional involved in the patient's care, and also how to access help, including the out-of-hours services. Joe, that's great. You can go up to the next one. So again, carers are given an opportunity, so you're able to have that chat with the coordinators, the opportunity to seek a professional on their own to get support for yourself. You have the right to your own confidentiality. So there's things that you might not want to share when talking with a professional, and that's absolutely fine. encouraged to be valued as a member of that team. So it's about how, again, when we looked at that triangle care, is how everybody pulls together to support that individual who's being cared for. So it's not keeping people out of the loop, but it's how we can work together to make sure we're protecting people's rights, but also giving the right support for the person that's being cared for. Again, confidence. So it's about you being able to have the confidence to have those chats with professionals about any concerns that you may have. So again, when you talk with professionals, you can just say that, you know, I don't want to know information because I understand there's obviously confidentiality in place. The carer cared for doesn't want to share that information, but I have information that I need to be able to share with you that might be able to help with the person's care or my concerns about their health. So it's giving you that opportunity that you can voice those opinions. Again, help to access an assessment of your own needs again, and again, be written into the support plan. So i.e. if the patient has a serious mental health illness or learning disability. Joe, that's great. Oh, and yeah, thank you for listening to me. So what I'll do, I will ask Joe just to end the recording now, so we've got the opportunity to ask questions. Like I said, I will do my best. If not, I can't answer them, I will pass them on to Sophie, and hopefully we can get some input at a later date.